It's no secret that access to healthcare in African countries is a struggle, to say the least. Now, many women and girls can't always afford healthcare or get to the necessary clinics or get the medication due to a number of factors. And that's exactly what the African Women's Summit is aiming to address. The summit, which started today in Cape Town and will continue tomorrow, discussed issues around access to healthcare, testing, and also addressing the various types of cancers faced by many women in these regions. It's expected the number of cancer cases worldwide would increase to 29.5 million in 2040, with Africa experiencing the most cases. To speak to us some more about these challenges and potential solutions, I'm joined by Marilyn Steenkamp. She is the General Manager of the Southern Africa Multi-Country Network at Roche and a panelist at this important summit in Cape Town. Thanks for your time this evening, Marilyn. What did you feel was the reason for the need to get a panel like this together at the African Women's Summit in Cape Town? I would assume that when battling so many of these kinds of challenges, there is the issue of potentially people ending up working in silos, and getting all of those people in one room can only be beneficial.
Yeah, that's exactly right. Access in Africa and the exposure to diagnostic testing for women is still a problem. The prevalence of women cancers are increasing, predominantly breast and cervical cancer, and the rise in this for women in Africa is truly exorbitant and worrying. And important to that is only 19% of the population in low to middle income countries in Africa have access to basic testing. So really the essence of having topics like this addressed is really to recognize the issues we have in Africa, to recognize that we need to generate access, and importantly, that this can't be done alone. Yeah. We need multi-stakeholders involved, public-private stakeholders, to help in the fight against cancer.
Now, Africa has the highest percentage increase projection in cancer compared to other regions. We've seen those numbers before. There hasn't really been a blip in it going downwards over the last few years. And the prevalence, especially of women's cancers, is higher than others. I think specifically, I remember doing a story, if you look at an area like the Northern Cape, in South Africa, where access to clinics are difficult because of the vast distances that people need to travel. And this is a kind of issue that you find in large parts of Southern Africa, especially as well. Have yourself and your colleagues and the panelists at the summit, are you hoping to get to a point that you know exactly what is behind these African regions having much higher percentile numbers in that regard? Or is it a cocktail of various issues that we're facing here?
Yeah, I think it is a cocktail of various issues. I think in Africa, we have to acknowledge that the stakeholders are a multitude. We have access issues, we have pricing issues. So we really need stakeholders across the board to collaborate. We have a strong drive at Roche for public-private partnerships to create platforms to get these bodies together to speak about the impact that we can make. But I think pivotal to that is also getting our ministerial of health bodies across Africa, the stewarded their mandates in supporting universal healthcare. And it can't be done alone. And I think private sector fully acknowledges our role in bringing world-class treatment, diagnostic testing kits to the continent. But this is certainly a collaborative measure. And there is some substantial work happening with various clinics that deal with holistic women's healthcare across Africa, but we need it to accelerate. We need the women to have access to this healthcare offering.
The fact that you state the need for the private sector to stand up really must be noted, because I don't think that has been said enough by people in a position such as yourself, because I'm sure you will admit that the pharmaceuticals like the one that you work for is often painted as the big bad guy. But the point is you are a big guy, which means that you are able to mobilize. You have the numbers, you've got the distribution potential. And the fact that you're wanting to step up to say we do have a role to play, do you believe that enough is being done by other pharmaceuticals such as yourself? Do you think that the relationship between public and private sectors is where it should be? And how fast do you think this could move if there is enough of a will amongst both public and private sectors to get to what you call the WHO's 2030 goals of eliminating cervical and breast cancer?
You're right. Are we doing enough? Probably not. We need more stakeholders on board. The 2030 target of WHO is really achievable. You have countries like Australia that have eliminated cervical cancer. We have great work happening in Africa if you look at what's going on in Rwanda today. So the possibilities are there, but we need to be supporting other countries as we progress by collaborating, by sharing more. What are some of the learnings, the obstacles that we all face towards this universal healthcare and women's health? So this is a call for action, and the summit is really one of these topics and platforms that drive this awareness and collaboration. It's starting to happen. Is it where we need it to be? Certainly not. And I think this is one of the platforms that we have as a call to action to all stakeholders to get us towards where we need to be.
How important in this ecosystem of trying to solve or help get to a better position with these healthcare challenges, how important is the role of women in the ecosystem? Because they are at various touch points here. Not only are they on the receiving end of these very high cancer numbers, we know that, they also are the majority of our healthcare workers. Women are by the vast majority making healthcare decisions in various households and in communities as well. And we did see during our battle against COVID-19 that Africa, especially here in South Africa, we know that, have leading female scientists that are leading teams doing amazing work in the health sector in terms of innovation and research. It really probably can't be overstated how important the role of women are in this battle, but are there enough then in the decision-making positions where it really matters?
So I think you have a swing starting to happen. I see personally a lot of women stepping up and standing up to the fight against it. We see a lot of the first women of various countries stepping up and leading projects. There are projects such as the Empower Her clinics that are mobilizing across Africa. So it's starting to happen, but we really need more of these women in positions of power to make a difference. And you're right. The woman is the center of a household. She's the caregiver. She's the decision maker on medical activities in the household. She's the primary support structure. And we do need to support them as we move the needle. So there are women in power. We have great clinicians that are mobilizing the movement on cancer, on cervical cancer, on breast cancer, research and development, but we need more. Our jobs are not done.
Absolutely. And just before I let you go, a summit is a talk shop. You know, it's great to have everybody in the same room. Instead of saying, I sent you this email on this, please will you revert? The hope is that there's more than just engagement that comes out of something like this. What would make you happy walking away from this summit at the end of it?
That we have more stakeholders engaged on the topic, that we mobilize funders and partnerships in Africa to generate funding models, support models, program mobilization. You know, it's such a fundamental piece. You know, you can diagnose someone, you can vaccinate someone, but we have to holistically manage this woman. So from diagnosis to treatment, so the holistic care across, the continuum would make me very happy that we have stakeholders that are intervening across all of these sectors.
Fantastic chatting to you. Thank you so much for your time this evening. Marilyn Steenkamp is the General Manager of the Southern Africa Multi-Country Network at Roche and a panelist at that Women's Summit taking place in Cape Town from today. We thank her for her time this evening.